Thank you for downloading Children's Pedcast. I'm Jimmy Bellamy, and this week my guest is Joe Kurland, a vaccine specialist here at Children's Minnesota, and we're going to talk about flu and vaccinations. And this is going to be an extremely timely talk, given that we are currently recording during the winter flu season. And Joe, give people a little bit of a taste of what you do here and your background of where you come from, what you've done to get to this point.
Thanks, Jimmy. I am a master in public health, and that means I went after my college degree. I went off to the University of Minnesota, got my master's degree in public health, and have been doing a couple different odd jobs. I had everything from working for Regents Hospital as a emergency room technician. Then I got to go and do some research at the hospital as well. I worked at the Minnesota Department of Health doing infectious disease epidemiology, basically watching for disease cases and counting them and helping keep track of what we're seeing in the state. And then I got hired at Children's Hospital, working as a, like you said, vaccine specialist, and I'm also the infection preventionist for our ambulatory divisions. So helping the staff and patients and visitors all stay healthy and not transmit diseases to one another. And as for the infection prevention side, for the vaccine specialist side, I am a resource and provide Q&A responses whenever staff or outside agencies, even our community partners, need to have questions or have questions about vaccines and their schedules and contraindications and other things like that.
Well, I want to ask you about the flu and everything that it entails, because especially this time of year, people get sick. People usually almost by default say, I have the flu. And I know that there are times where it may be flu and there are others where despite your symptoms, it's not.
Yeah. And I think one of the most common confusing items is that people say, oh, I got the stomach flu, or I got the 24-hour flu. And neither of those is the flu. So the flu is influenza. It's caused by a couple different viruses, and we have a vaccine for those. But the virus itself attacks your body, and it feels like you got hit with a Mack truck, and you are suddenly and quickly laid out. You're not going to be going to work. You're in no condition to be going up doing anything. It very rarely involves vomiting or diarrhea. It's mostly just massive fatigue, body aches, muscle aches. You're going to be not hungry for anything. You might have a fever. You're probably going to have a fever, and you have other kind of symptoms like that. But when you're talking about the stomach flu, the 24-hour flu, that's typically food poisoning. There's a lot of different diseases that happen this time of year because we're in such close proximity to each other. We're all indoors. And during the holidays, we're also sharing a lot of different food stuff. So there's a possibility that people are getting sick from what they're eating or what they're sharing with other people. If your kids are going to schools or daycares, or, when school starts up, we see a large increase in disease as well. But those diseases typically recover in about 2-3 days, or maybe even the 24-hour flu, you get better the next day. That's a really quick kind of thing. The flu, you'll be knocked out for several days, and you're not going to be in any condition to work. And even like basic Tylenol won't get you back on your feet.
What are some ways, or what are all of the ways to prevent flu? I know that you have everything from the basics of clean hand hygiene, washing hands on a regular basis with warm soapy water, and then also everything to vaccinations. So kind of run down that list of things that people can do in order to best prevent the flu.
Well, aside from living in a bubble and staying away from people altogether, that's not realistic. So like you said, washing your hands, soap and water, really focusing on not touching your face, I think, is one of the big things that people don't focus on enough. But if you've ever seen the movie Contagion,
yes.
And she says, stop touching your face so much. And he's like there, like rubbing his fingers into his eyes and nose. And it's just disgusting. And if you think about it, if you catch yourself and monitor what you're doing with your hands throughout the day, you'll be surprised at how often you'll touch your fingers to your face. But so washing your hands is one of the easiest things we recommend. But again, you have to use soap and water. If you're during the winter, your hands can get really dried out. So we recommend actually using hand sanitizer more often. It's less drying to the skin. It keeps it intact, and you're less likely to get kind of those cracking of your skin and problems like that.
I'm looking at your hands right now, and they look pretty good for this time of year.
Yeah. And I get really dry hands during the winter too. So I recommend moisturizing if you need to do that, prevent it from getting cracked and sores and whatnot. But, that's one of the basic things. The other thing you can do, if you have kids around and they're coughing or sneezing, make sure they're doing it into a tissue and then washing their hands, or they're not just coughing out loud, but really kind of covering it with their arm. And when you talk about covering your cough, it used to be, cough into your hands and then go wash your hands. It's not realistic to get people to wash their hands that much. So what we've really encouraged is they bring their arm up, go to their elbow, kind of put their mouth and nose into their elbow and cough or sneeze there, because if you're going to shake hands with somebody, you're less likely to come in contact with the crook of your elbow than you are with that surface. So
that actually made me think of a question that I've wondered and never said out loud. Is it, and this might seem obvious, is it recommended that at the end of that day, you throw that shirt in the wash because you are sneezing on it or near it?
Oh yeah. And if you look at it and you got goobers in there, you got little gross kind of liquid stuff.
Hopefully if something's visible, you're addressing it immediately.
Oh yeah. And hopefully you're getting a tissue or like a little cleaning wipe or something like that to get it off. But yeah, you want to get out of that. You want to clean it and wash it. And if you got kids like I do that are not healthy during this time of year, that go to preschool and kindergarten and first grade, and it kind of gets to the point where it looks like the sleeve of their coat or their arm can basically stand up on its own.
Yeah.
Don't get there. Wash your kids' jackets.
Absolutely.
Wash your kids' shirts. Just take care of it. And like you said, so that's kind of the low intervention. One of the other kind of medical interventions you can do to prevent flu is get your flu shot. It's a very effective vaccine. It's easy to get. There's been a lot of news about how well it works, and I think it's an issue with, we can go into that a little bit more in a little bit, but how it's predicted, how it's created. There's some issues with that, and hopefully we're going to be improving that in the coming years. But it's the best thing we got right now. And there's studies out there that say that, it's only 60% effective overall. And that's for the entire population. In some groups, it's more effective than not.
And is that the current one?
The current one, yes.
Okay.
And last year was a bad example. Last year was bad.
Is it safe to say that was an anomaly, that it was a giant swing and a miss? Is it fair to characterize it as that?
It wasn't a swing and a miss. It was more like swinging well after the ball had been pitched, but we do that every year. And sometimes on that backswing, you can kind of get it.
Yes.
So
fall tip.
As you follow through, you kind of get it. But the problem was that last year, the flu virus that was circulating in the community, so what we call the wild type flu, that changed a little bit, something we call antigenic drift. And it shifted a little bit, but just enough that the flu vaccine wasn't going to be working. And they realized, or they discovered, that this happened well after, or a few months after the flu vaccine was locked, and sent out for production. The flu vaccine takes months to prepare because it's grown up in chicken eggs. It's still a 1950s technology that they're using to generate the population's flu vaccine. And this is actually global supply, both the injectable and the intranasal. And it's frustrating because once they realized, they knew that this wasn't going to be as good. They hoped it was going to work better, but they were surprised, I think, just how poorly it worked. And they changed it. They updated the vaccine model for this year. That is actually still the same wild type that's out there in the community, and it's actually working great. I mean, I think we've had 1 or 2 flu cases at our hospital this year. Minnesota this week reported the second week in a row of a declining number of cases showing up to clinics. It's really kind of an odd year. I don't want to get too excited or jinx it too much, but I think we won't be seeing as big a spike as we saw the year before. But I'd be interested to see what kind of when the cases are going to start turning up. I think it's going to be later this year.
This year and I say this year as in 15, 16, not just the 2 weeks that we've been in 2016. This year has been drastically lower from a year ago. And I think it is because not only the awareness that last year's created, but also the fact that you said that what you call the wild type it's the same. So in the production of the new vaccine, they were able to prepare for that and make it match. Is that accurate?
Yeah, I think that's a good way of looking at it. Also, when you look at kids that get the disease, you get natural immunity that sticks around for a period. So there's not as many what we call susceptible hosts, or people that can get infected by the virus. So with not having as many people to get sick, the vaccine just kind of tootling around and finding people where it can and when it can. But flu is one of those complicated vaccines. It's not like measles or the mumps or diphtheria or other diseases that we have vaccines for that have not changed in decades. Flu has to be updated every year because it's a very complicated virus. It can survive in several different hosts, including humans, pigs, birds, horses, and seals, apparently. And when these animals kind of mix, or if, like a pig has a normal pig virus and suddenly it's, at one of our farms and it comes into a farmer that has the flu or a worker that has the flu, and both of these viruses get together in the same animal, there's a chance that you might have kind of a crossover reaction or a recombination. That's called antigenic shift. And when that happens, that's when you get the pandemic flus. That's when the new ones that come out that no one has immunity to. And that's what we saw in 2009. That was the 2009 pandemic that came from the pigs in Mexico. Originally started in pigs, jumped to humans, and just burned through. And so we had lots and lots of kids coming in, both for the vaccine once that was produced, and kids that were sick with the vaccine. And that was the last pandemic flu. But apparently since the 1800s, I think since we've been recording it, I think there have been reported about 5 different cases of pandemic flu due to antigenic drift or antigenic shift, be like that.
I know that vaccines are critically important to the health and well-being of not only yourself but the community, because there are those who, due to their immune systems being compromised, aren't able to get vaccinated and immunized. But that said, until I started working here about 2 years ago, I had always seen the flu shot as a separate vaccination that, it's optional. And it's because in my head, I thought the stomach flu was influenza and didn't realize that there was a difference, that it's not actually flu. And that flu, true influenza, is dangerous, potentially fatal, and that it's important to annually receive that flu shot. And I can assume that I'm not the only one who has thought that.
Yeah, and I don't think you shouldn't be so hard on yourself.
Thanks.
I think when you're and I are about the same age, and I'd say that when we were younger, that was the guidance, that it is optional for young, healthy adults or young, healthy individuals.
Yeah, that works.
The primary folks that get and suffer the severe cases of flu, if you look at a graph and age is on the bottom, with the youngest kids being near the origin or that zero line, and then as you move to the right, people get older, the graph kind of looks like a U, and you see the young kids and the infants having the most cases and having the most severe cases. As you get older, it kind of drops down, and then the elderly folks that have other health issues and other problems that have collected over a lifespan, they actually suffer a lot of the disease too. So those were the primary targets when the first influenza vaccines were coming out, them in the military. Then they started expanding it. They wanted to have anybody with respiratory illnesses, anybody that was pregnant, anybody that had worked in healthcare and was becoming in contact with us. And slowly, as they've actually realized that this could be a valuable vaccine and that it's actually working to prevent the disease, and we realize that it's actually a great tool, the more people that get it. And basically, if you imagine individuals all standing up like people at a dartboard, the flu is going to go out there and it's only going to hit a couple things at a time. And if you can actually shrink the dartboard down by having less people available that can get it, it's going to be harder for that flu vaccine that flies through the air coming to get you and won't connect as many times. And so I think the public health agencies realize that as the population, as more and more people get the flu shot, they can actually interrupt or stop the flu from transmitting and causing these giant outbreaks, because there's less people that can get it, less people that can transmit it, and they basically don't see the giant outbreaks like we did before.
In managing Children's Minnesota's social media channels throughout last flu season, I saw frequent comments saying, this year's flu vaccine doesn't work, it's not worth getting. And I would argue, and I know other medical professionals, I'm not a medical professional, but medical professionals would also say, if it is improving your chances of staying out of the hospital or not getting influenza, get it. It may not be 100% effective, but if you have an opportunity to reduce your risk of getting severely ill, why would you not take it?
Right. And I think the other thing that's important is you don't know which flu you're going to get. And you might get flu a couple times during the year. The flu vaccine in previous years has been this trivalent vaccine. It has 3 different types. Now they've moved more towards this quadrivalent vaccine that has 4 different types. It's 2 types of what they call a type A and 2 types of a type B. And what they're finding is that even if you get the flu, even if the flu didn't work for that one type of an influenza A last year, there were 2 or 3 other types, depending on which vaccine you got. There were 2 or 3 other types of flu that you were going to be protected against, and it worked very well against those. And we don't know, the majority of the cases are this influenza A, H3N2, I think is what the circulating virus is. And we actually are participating in a study at the Minnesota Department of Health called the SARI Project, and I'm sure we can put a link to that someplace.
Absolutely.
But they actually, if you look for a virus, if you're looking to see what's out there, you're going to find a lot of different things. And not all respiratory illnesses, not all cold symptoms you get are going to be influenza. Like we talked about flu, there are other viruses that can knock you down pretty hard. There's like human metapneumovirus, parainfluenza. There's a bunch of different types of diseases out there that can make you very, very ill and actually result in kids being hospitalized. And, when you say that getting the flu shot doesn't make sense because it's not working this year, that's not wholly true because, even though the flu vaccine we said was like 60% effective overall, if you don't get the flu vaccine, it's 0%. And 60% versus 0, I mean, how many people just bought tickets for the lottery? And you have a much lower chance than 60% of getting into the lottery. If you bought a lottery ticket, you better have gotten a flu shot because you have a much better chance of being protected against the flu than you would have about winning that jackpot.
And just like the lottery, if you don't buy a ticket, you're guaranteed to not win.
Exactly.
And if you don't get a shot, your chances are at 0, like you said.
We shouldn't say that because if you don't get a flu shot, you're not guaranteed to get the flu. And so that's a tricky one because you can't say you're going to get...
Oh, yeah. That's true. And I didn't mean it. That's why you're here, Joe. That's exactly why you're here. I did not mean it the way it sounded. You are absolutely right. Yeah. No, not getting the flu shot is not a guarantee that you will get flu, of course.
But that brings up a good point because a lot of people say that, you get the flu shot, I get the flu. Or I get the flu shot and I get a cold. Lewis Black has a great bit about that too. But
he's a funny man.
Yes, and it's interesting because it's not, you don't get the flu from a flu shot. It's impossible. The flu, the virus that they have in the flu shot that's injected into your arm is dead. It can't replicate. Your body sees it, your body takes it and makes antibodies, but it can't do anything.
Are you sure it couldn't be an undead flu? It couldn't be a zombie flu?
Actually, they're talking about that. That's actually what the nasal spray is, the undead flu, because it's what they call a live attenuated virus. It's weakened to the point that it cannot cause infection. It's actually really cool science if you're a virus nerd like me.
It does seem fascinating.
But they spray it into your nose, and because of the temperature in your nose, it can grow a little bit and help stimulate your body to generate a natural immunity to it. But if it gets down into your throat or your lungs, your body temperature is going to kill it off. It's pretty cool how it breaks apart just so easily.
The human body is amazing. And I don't want to get too far off track, but I think about if you get a simple cut on your finger, to watch it heal over a period of days, it is amazing just what our bodies can do. I've always wondered, because you work in the area you do, are you hyper cleanly? Would somebody call you OCD? What is daily life like for Joe Kurland when it comes to making sure your doorknobs are clean, making sure you're washing your hands before and after eating? I mean, what's it like?
I am absolutely, I think my coworkers would vouch for this. If they saw my desk, if anybody sees my desk, I am not a hyper clean person.
Oh, okay.
I wouldn't go so far as to, like George Carlin said, that you have an immune system, you need to make it practice. I think you get enough practice from daily exposures. You don't need to intentionally contaminate yourself. I think keeping hands clean, I think if you use the bathroom, wash your hands before and after you eat. I think there's a lot of times where you need to do it. Yeah, like my kids right now are not well at home, and I'm going to be going around and cleaning off toilet flush handles, sinks, doorknobs, and that kind of stuff, but they're acutely ill. I don't want to spread it in the family. But in the absence of that, we do the normal cleaning that I think most people do. You're going to vacuum, you're going to clean, you take baths on a regular basis, you wash your hands, and your basic hygiene. And the other one is, I'm trying to really get my kids, including my little 2-year-old, to cover her cough. And she goes, "Daddy, I did it." And she's actually got her elbow down below her chin, and that's how she's covering. I'm like, "No, you gotta get your arm up," and she rolls her eyes at me already too. So.
Raise it up a little, get that shoulder working. When it comes to the flu, we know there are so many types, and not everybody knows that, but you've talked about a few. But I want to make sure I'm not using the wrong language. You have types, subtypes. Is it? You can get into that in a second. Is it possible to believe that there will be a day where a cure for the flu exists, or is it just so massive or so unique in the way it mutates and changes that we're just going to have to combat it each year with a shot?
So you're talking about the universal flu vaccine.
Correct.
They're working on that right now. And actually, I think they have some pretty good leads that in the next 10, 15 years, we might be seeing it come on the market, or at least being put into trials. Like I said about this flu season that I was cautiously optimistic that the flu vaccine was a good match. I'm cautiously optimistic that that's actually going to happen. And you'll be getting a flu shot then, if that works. I imagine it'll be akin to your tetanus booster. Like every 10 years, you just need to get an update or a booster shot to make sure your immune system's good, but not needing it every year. That is kind of what Patsy calls the holy grail for vaccine folks.
And Patsy Stinchfield, of course, is she the director of infection? She has so many titles, I always mix it up, so I figured I'd just let you say it.
So Patsy Stinchfield is the director of infection control. She is a nurse practitioner and is a vaccine expert, and I am but her protege.
I always say you are the Robin to her Batman.
I think she would like that, yeah. I don't pull the stunts that Robin does in the comics, though. So
no, and Robin, I think, especially like original Robin, he complained a lot too, didn't he? Or he was kind of scared.
I hope I
always see that comic of Batman slapping Robin, and then it's that meme that goes around.
Yep.
I do have to ask you too. You had mentioned about this time of year being a time where we're cooped up, we're confined, we're sharing a lot of meals due to holidays and everything. But is there something specific about winter weather that leads to more illnesses? People talk about, I was outside in the cold and now I have a runny nose.
Yeah. So the old, your mom said, go out. If you don't wear a hat, you're going to get a cold. That yes. Doesn't really hold true.
Okay. Take that, Grandpa.
You might get hypothermia, but you're not going to get a cold. Although having hypothermia may weaken your immune system, causing you to be more susceptible to it. So it's a chain, like a domino effect.
Okay.
So it's possible. But I think what they're looking at right now, there's research being done looking at, what are the factors that allow flu virus to survive and be transmissible to other people that makes it so more frequent in winter than it is in summer. And that's, it happens at both ends of the world that while we're here in the we're here in the winter season, the southern hemisphere, like Australia, South Africa, are in the summer season, and they see a drop in flu cases like we do during our summer. So it follows the seasons. Whereas if you're in kind of the middle climate areas on the equator, I think they see kind of a level number of flu cases year round.
Okay.
So, but what's interesting is they're looking at different dynamics from what the ambient temperature is, people's proximity to one another, relative humidity, and is the drier kind of cool air more allowing to have the flu virus survive and be able to go from person to person, as opposed to during the summer, when is it because we're all outside and there's more space between people, we're not coming in contact as frequently, there's more sunlight that can kill off viruses with the UV rays, or is it just the humid air that breaks it apart more quickly? We don't know yet.
For parents who have a child with the flu, or they suspect their child may have the flu or flu-like symptoms, what do you recommend they do as far as steps they take, whether it be a family locally here in the Minneapolis-St. Paul area or people listening anywhere?
I think you got to address the symptoms. If you suspect the flu, there are medications available that can help help speed along the recovery. They're not perfect, but I think if you have a concern about it, contact your pediatrician. See if that's an option. See if they want you to come in to get evaluated or possibly tested for flu, so they can say, yeah, it is flu, we can give you this medicine, or no, it's not. But don't go in there asking for antibiotics. Antibiotics don't touch viruses. They don't help. And if you have antibiotics left over in your home, don't give them to your kid without a prescription. Don't just give them willy-nilly. That leads to other problems. But yeah, you're going to...
No, absolutely.
I was going to say that, treat the symptoms. The best thing you can get for influenza in general is rest. And you're going to keep your fluids up, let them relax, try to get them to lie down, not run around. Like I said, I've got kids, so it's a challenge. If they start feeling, you get them a little bit of Tylenol or ibuprofen in them, and they start feeling better, and they want to go outside and play and do all kinds of crazy stuff. And it's like, no, sit down. You need to relax, and keep drinking this Gatorade or fluids or whatever we can give you. The other thing is that if you notice that anything else is happening, if they're having difficulty breathing, if they start having other symptoms, you can't wake them up, or they have awareness problems or other things like that, get them to the emergency room. That you don't want to mess around, because one of the complications that can happen with influenza is it can lead on to a rapid onset of pneumonia if it's really bad. And pneumonia can be a life-threatening illness and really should not have any waiting. But it happens occasionally with influenza. It's not a guaranteed, but it is one of those things that causes influenza to be a life-threatening illness. Not directly, but from other type of opportunistic infections like pneumonia. And what people forget, you mentioned that flu is actually a serious disease that we took for granted. And it's like, oh, it's just the flu. I don't ever want to hear somebody say it's just the flu. Influenza actually can account for as many deaths in this country annually as the number of traffic fatalities or car accidents in this country as well. They're about equal. And that's a pretty scary number in the tens of thousands.
It's a significant chunk, and in stories I've read, whether it be actual stories in newspapers or seen on television news or flu-based or health-based publications, to see those numbers, it's quite jarring to realize that it can and will affect so many people each year if the proper steps aren't taken in battling it.
And the proper steps being get your flu shot, stay healthy, and cover your coughs.
And wash your hands. There you go. Wash them proud. Is there anything else you'd like to add before we go?
I think if anybody has questions, they can feel free to reach out. There's great resources online, and I can provide you some of those informations that maybe we can share that with some of our listeners.
That'd be great.
I think, if you have questions about flu, talk to your healthcare provider, say you're concerned about it, and, encourage the friends around you. If you've got family and friends that come over a lot, if you have a newborn, really encourage folks to consider getting that flu shot. If you're a mother, if you're pregnant and expecting, if you're a new parent, get the flu shot, because the babies can't get the flu shot until they turn 6 months. And you really want to surround that infant. If you're in the middle of flu season, if you had a September or October baby, get them covered and surrounded by folks that have protection against the flu, and minimize the risk that they have for contracting this disease.
Well, Joe, I can't thank you enough for joining us today. You do great work here at Children's, and it's always enjoyable to work with you and Patsy. So I appreciate the time and this valuable info.
Jimmy, likewise. Thank you very much. This was fun.
Thank you.